Welcome back to Morning Rush at 6:15. Immunizations are an important part of going back to school, but pediatricians all around the country are reporting a drop in the number of children coming in for checkups that include vaccinations. But why? Here's our Y guy, Jerry Carnes.
Families have made major changes to avoid a virus that has dominated the headlines. But COVID-19 isn't the only threat. In March, pediatricians like Dr. Andy Doyle of WellStar Health Systems and Dr. Joanna Dolgoff saw a sharp drop in the number of parents bringing their children in for checkups and vaccinations.
Our visits were down 60% in March and April.
It's starting to come back.
Vaccines exist to protect children from diseases like measles, mumps, and hepatitis. Let's explore why many parents stop bringing their children to the doctor. Pediatricians are seeing a resurgence, but visits aren't back to pre-pandemic levels.
The problem is that because so many children missed their well visits, they're now behind on vaccines.
Fear of COVID-19 has kept many from the doctor. Pediatricians have put safety measures in place, like separating sick children from those coming in for regular checkups.
Patients wait in their cars instead of the waiting rooms.
Patients are screened before they come into the buildings.
Everybody who steps into a doctor's office now is required to wear a mask.
The financial burdens brought on by COVID-19 have convinced some family members to place checkups and vaccinations lower on the priority list.
If you get too far behind your vaccines, it definitely takes a longer time to get caught up.
Last year, the U.S. saw its worst measles outbreak since 1992 with nearly 1,300 cases. Most of the people who got sick were unvaccinated. Pediatricians would hate to see a similar problem as parents try to avoid the bigger problem of COVID-19.